Waking up with a dry mouth? Your body may be sending you an early warning. Have you ever woken up in the morning with your mouth feeling so dry that your tongue sticks to the roof of your mouth? Maybe the first thing you do is reach for a glass of water beside your bed. Many people assume it's just another part of getting older. But in most cases, that's not the real reason. I'm Dr. Nathan Ashford, and after years of caring for older adults, I've learned that a dry mouth is rarely just an inconvenience. It's often one of the earliest clues that something inside your body deserves attention. Saliva is far more important than most people realize. While you're asleep, it protects your teeth, controls harmful bacteria, helps you swallow comfortably, and even reduces the risk of infections reaching your lungs. When saliva production drops, those protective functions begin to fail long before other symptoms appear. That's why waking up with a dry mouth every morning shouldn't be ignored, especially if it has been happening for weeks or months. In many adults over 60, persistent dry mouth is linked to medication side effects, uncontrolled blood sugar, sleep apnea, dehydration, autoimmune disorders, or even kidney problems. The dry mouth itself isn't the disease. It's often the warning signal that appears first. The good news is that once you understand what your body is trying to tell you, many of these problems can be identified early and managed before they become much more serious. In today's video, I'll explain why saliva matters more than you think, the most common causes of morning dry mouth, the warning signs you should never ignore, and simple steps that may help you restore comfort while protecting your long-term health. Before we continue, take a moment to tell me in the comments, how long have you been waking up with a dry mouth? Days, months, or even years? Your answer may help someone else realize they're not alone. Now, let's begin with something most people have never been told: the remarkable job saliva performs every single night while you sleep. Part 2. Why saliva is more important than most people realize. Before we talk about what causes dry mouth, you first need to understand why saliva matters so much. Most people think saliva is simply water that keeps the mouth moist. In reality, it's a complex fluid packed with enzymes, minerals, antibodies, and protective proteins that work around the clock, even while you sleep. One of its most important jobs is controlling harmful bacteria. Your mouth naturally contains hundreds of different types of bacteria. Most are harmless as long as they're kept in balance. Saliva acts as your body's natural defense system, washing away bacteria and preventing them from multiplying overnight. Saliva also protects your lungs. While you sleep, tiny amounts of saliva naturally travel toward your airway. This happens to almost everyone. When your mouth is healthy, those secretions contain relatively few harmful bacteria, so your lungs can clear them without difficulty. But when your mouth stays dry night after night, bacteria multiply rapidly. That increases the chance of respiratory infections, especially in older adults whose immune systems are already less efficient. It also plays a critical role in digestion. The digestive process doesn't begin in your stomach. It starts the moment you begin chewing. Saliva contains enzymes that begin breaking down carbohydrates, softens food, and makes swallowing easier. Without enough saliva, eating becomes uncomfortable, and many older adults gradually avoid nutritious foods because they're simply harder to chew and swallow. Finally, saliva protects your teeth. It constantly washes away food particles, neutralizes acids, and delivers minerals that help repair tooth enamel. When saliva decreases, cavities, gum disease, bad breath, and mouth infections can develop much faster, even in people who brush and floss every day. That's why dry mouth is much more than a comfort issue. It can quietly affect your nutrition, oral health, breathing, and overall well-being. The next question is the most important one. Why does saliva suddenly decrease? Surprisingly, the answer is often hiding in something millions of older adults use every single day, without realizing its side effects. We'll look at that first. Part 3. The #1 cause of dry mouth. After 60, your medications. If you're over 60 and wake up with a dry mouth almost every morning, the first place to look isn't your age, it's your medicine cabinet. Medication side effects are the leading cause of chronic dry mouth in older adults. In fact, hundreds of commonly prescribed and over-the-counter medications can reduce saliva production. Many people take them for years without realizing they're affecting their mouth every single night. Some of the most common culprits include blood pressure medications, diuretics or water pills, allergy medicines, antidepressants, bladder control medications, sleep aids, and certain antihistamines. None of these medicines are bad. They often play an important role in keeping you healthy. The problem is that many of them can interfere with the nerves that stimulate your salivary glands. The risk becomes even greater when several medications are taken together. Each one may reduce saliva only slightly, but their effects can add up. That's why many people notice dry mouth gradually becoming worse over time, instead of suddenly appearing overnight. Unfortunately, many older adults assume it's simply part of aging, and never mention it during a doctor's visit. Others mention it briefly, only to be told to drink more water. But water provides temporary relief. It doesn't solve the underlying problem if your salivary glands are being suppressed by medication. This doesn't mean you should stop taking your prescriptions. In fact, stopping medications on your own can be dangerous. Instead, make a complete list of everything you take, including vitamins, supplements, and over-the-counter products. Then ask your doctor or pharmacist if any of them could be contributing to your dry mouth, and whether safer alternatives are available. Sometimes, a small adjustment in dosage or switching to a different medication can make a remarkable difference without affecting the treatment of your medical condition. But medications aren't the only explanation. Sometimes, a dry mouth is your body's first clue that an underlying disease is beginning to develop. In the next section, we'll look at the medical conditions most commonly linked to persistent morning dry mouth, and the warning signs that should never be ignored. Part 4. Could your dry mouth be warning you about an undiagnosed health problem? If your medication list doesn't fully explain your dry mouth, it's time to consider another possibility. Your body may be trying to alert you to an underlying medical condition. One of the most common is type 2 diabetes. When blood sugar remains high, your body pulls more water from its tissues and produces more urine to remove excess glucose. As a result, many people experience constant thirst, frequent nighttime urination, and a dry mouth that feels worse every morning. For some, these symptoms appear long before diabetes is officially diagnosed. Another common cause is sleep apnea. If you snore loudly, wake up tired despite a full night's sleep, or someone has noticed that you stop breathing during the night, sleep apnea may be the reason. Repeated mouth breathing and interrupted breathing can dry the mouth for hours while you sleep, leaving you with severe dryness by morning. Persistent dry mouth can also be linked to Sjögren's syndrome, an autoimmune disease in which the immune system attacks the glands that produce saliva and tears. People with this condition often notice both dry mouth and dry, gritty eyes. It is especially common in women over 50 and is often overlooked in its early stages. In some cases, dry mouth may also point to kidney disease or significant dehydration. Healthy kidneys help maintain the body's fluid balance. When kidney function declines, that balance can be disrupted, leading to persistent dryness, fatigue, swelling, or changes in urination. While dry mouth alone doesn't confirm kidney disease, it should never be ignored if it occurs alongside these symptoms. The important message is this: dry mouth is rarely an isolated problem. It often appears together with other warning signs that, when viewed as a whole, tell a much bigger story. If you've been waking up with a dry mouth for several weeks, especially if it's accompanied by excessive thirst, frequent urination, loud snoring, dry eyes, unexplained weight loss, or unusual fatigue, it's worth discussing these symptoms with your healthcare provider. Identifying the real cause early can make treatment much simpler and may prevent far more serious health problems in the future. In the next part, we'll explore what can happen if dry mouth is ignored for months or even years. The consequences go far beyond bad breath or needing a glass of water beside your bed. Part 5. What happens if you ignore dry mouth for too long? Many people think dry mouth is simply annoying. They keep a bottle of water nearby, take a sip, and move on with their day. But when dry mouth continues for months or years, the effects can spread far beyond your mouth. One of the first problems is poor nutrition. Saliva helps soften food, enhances taste, and makes swallowing comfortable. Without enough saliva, eating becomes more difficult. Many older adults begin avoiding foods like lean meat, raw vegetables, nuts, and whole grains because they're harder to chew and swallow. Instead, they gradually choose softer, more processed foods that are often lower in protein, fiber, and essential nutrients. Over time, this change can contribute to unintended weight loss, muscle weakness, and reduced energy, problems that increase the risk of falls and loss of independence as we age. Dry mouth also creates the perfect environment for harmful bacteria to grow. Without saliva constantly washing the mouth clean, plaque builds up more quickly, cavities develop faster, and gum disease becomes much more common. Even people who brush twice a day may suddenly experience frequent dental problems simply because their mouth has lost its natural protective system. Another concern is infection. A dry mouth allows bacteria to multiply overnight. In older adults, some of these bacteria can be inhaled into the lungs during sleep, increasing the risk of respiratory infections such as pneumonia, especially in people with weakened immune systems or chronic medical conditions. Perhaps the biggest danger is that dry mouth often distracts people from the real issue. They focus on treating the symptom while the underlying cause, whether it's uncontrolled diabetes, sleep apnea, medication side effects, or another health condition, continues to progress unnoticed. That's why persistent dry mouth should never be viewed as just getting older. It may be your body's earliest opportunity to warn you that something needs attention. The encouraging news is that many cases improve once the underlying cause is identified, and there are also simple daily habits that can significantly reduce dryness and protect your mouth. In the next section, I'll share the most common mistakes people make when trying to treat dry mouth, and why some of the solutions you may have been using aren't actually solving the problem. Part 6. 5 common mistakes that can make dry mouth even worse. If you've been dealing with dry mouth for a while, chances are you've already tried to fix it. Unfortunately, some of the most common solutions provide only temporary relief, and a few can actually make the problem worse. The first mistake is relying only on drinking more water. Staying hydrated is important, but water isn't a substitute for saliva. Saliva contains enzymes, protective proteins, and minerals that coat your mouth and defend your teeth. Water simply passes through, leaving your mouth dry again within minutes. The second mistake is using alcohol-based mouthwash. Many popular mouthwashes contain alcohol, which can leave your mouth feeling fresh at first, but actually dries the tissues even more. If you have persistent dry mouth, choose an alcohol-free rinse, specifically designed for dry mouth instead. Another common mistake is breathing through your mouth while sleeping without addressing the cause. Nasal congestion, allergies, or sleep apnea often force people to sleep with their mouths open. As air passes through your mouth for hours, moisture evaporates rapidly. If this happens every night, no amount of water during the day will completely solve the problem. Many people also ignore their dental checkups because they believe dry mouth isn't a dental issue. In reality, dentists are often the first healthcare professionals to notice signs of chronic dry mouth. Early cavities, gum inflammation, or changes in the tongue can all provide valuable clues before more serious complications develop. Finally, one of the biggest mistakes is simply accepting dry mouth as a normal part of aging. Growing older does not automatically mean your mouth should be dry every morning. In most cases, there is an identifiable reason, and often a treatable one. The goal isn't just to make your mouth feel more comfortable. It's to find out why it's happening in the first place. The good news is that several simple habits can naturally stimulate saliva production and help protect your mouth every day. In the next part, I'll show you practical strategies that many older adults find surprisingly effective, and most of them cost very little or nothing at all. Part 7. Simple ways to relieve dry mouth and protect your health. The good news is that in many cases, dry mouth can be improved. While the right treatment depends on the underlying cause, there are several simple habits that can make a real difference and help protect your mouth every day. Start by staying hydrated throughout the day instead of drinking large amounts of water all at once. Taking small, regular sips keeps your mouth more comfortable, especially if you're taking medications that reduce saliva production. Next, stimulate your salivary glands naturally. Chewing sugar-free gum or sucking on sugar-free lozenges, particularly those containing xylitol, can encourage your mouth to produce more saliva. Many people notice relief within just a few minutes. Your environment also matters. If the air in your bedroom is dry, especially during winter or when using air conditioning, consider running a cool mist humidifier at night. Adding moisture to the air can reduce overnight dryness and make mornings much more comfortable. Good oral hygiene becomes even more important when saliva is limited. Brush gently twice a day with fluoride toothpaste, floss daily, and schedule regular dental checkups. Your dentist may detect early signs of dry mouth before they become serious problems. Pay attention to your diet as well. Limit sugary snacks and drinks, which can increase the risk of cavities when saliva is low. Instead, choose foods with high water content, such as cucumbers, celery, oranges, and watermelon. These foods not only help with hydration, but also stimulate chewing, which naturally increases saliva flow. If your symptoms remain severe, ask your doctor or dentist about saliva substitutes, moisturizing mouth gels, or prescription medications that stimulate saliva production. These treatments can provide longer-lasting relief than water alone. Most importantly, don't just treat the dryness. Look for the reason behind it. If your dry mouth has lasted for weeks, keeps getting worse, or is affecting your eating, sleeping, or speaking, it's time for a medical evaluation. In the final part, I'll give you a simple 2-minute morning self-check and explain exactly when dry mouth becomes a warning sign that should never be ignored. Part 8. A 2-minute morning check that could reveal more than you think. Before you reach for that glass of water tomorrow morning, take 2 minutes to pay attention to your body. This simple routine won't diagnose a disease, but it can provide valuable clues that are worth discussing with your healthcare provider. As soon as you wake up, ask yourself a few questions. Can you swallow comfortably without taking a sip of water? Does your mouth feel slightly dry, or does it feel completely parched? Is your saliva thin and watery, or thick and sticky? Do you notice a bad taste, bad breath, or a burning sensation on your tongue? Now think about the rest of your night. Did you wake up several times to urinate? Did you snore heavily? Do you feel exhausted even after sleeping for 7 or 8 hours? Are your eyes dry when you wake up too? These details may seem unrelated, but together, they can point toward problems such as diabetes, sleep apnea, medication side effects, dehydration, or autoimmune disease. If your dry mouth lasts for more than 2 or 3 weeks, don't ignore it. Make a list of all your medications, including over-the-counter drugs and supplements, and bring that list to your next appointment. Tell your doctor exactly when the dryness occurs, how long it has been happening, and whether it's accompanied by other symptoms like frequent urination, weight loss, dry eyes, or persistent fatigue. There are also situations where you should seek medical attention promptly. If dry mouth is accompanied by difficulty breathing, chest pain, sudden confusion, severe weakness, or an inability to swallow, don't wait for your next appointment. Seek emergency medical care immediately. Likewise, if you develop painful mouth sores, white patches that don't go away, or rapid swelling inside the mouth, you should be evaluated as soon as possible. Your body rarely sends warning signs without a reason. Dry mouth may seem minor, but sometimes it's the first visible clue that something else deserves attention. Listening to that signal today could help you prevent much bigger health problems tomorrow. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with someone who wakes up with a dry mouth every morning. You never know. This information could help them recognize an early warning sign before it becomes a serious health issue. Until next time, take care of yourself, stay healthy, and remember, the small changes your body whispers today are often easier to treat than the problems it shouts about later. Part 9. Questions you should ask your doctor about persistent dry mouth. If you've been living with dry mouth for months, or even years, don't leave your next appointment with only the advice to drink more water. Instead, go prepared with the right questions. First, ask whether any of your medications could be reducing your saliva production. If you take medications for high blood pressure, allergies, depression, bladder problems, or sleep, ask if there are alternatives that may be less likely to cause dry mouth. Never stop a medication on your own, but don't assume the side effects can't be improved. Next, ask whether you should be tested for common medical conditions linked to dry mouth. Depending on your symptoms, your doctor may recommend checking your blood sugar for diabetes, evaluating your kidney function, reviewing your electrolyte levels, or arranging a sleep study if sleep apnea is suspected. If you also have dry eyes, joint pain, or unexplained fatigue, it may be appropriate to discuss testing for Sjögren syndrome. It's also important to let your dentist know about your symptoms. Dentists often recognize the effects of reduced saliva long before major dental problems develop. They may recommend fluoride treatments, special toothpaste, or other strategies to protect your teeth. Remember, persistent dry mouth isn't something you simply have to live with. In many cases, identifying the cause leads to meaningful improvement. Some people feel better after adjusting a medication. Others improve once diabetes is controlled or sleep apnea is treated. The key is finding the reason rather than masking the symptom. The sooner you start that conversation, the easier it is to protect not only your mouth, but your overall health. In the final part, I'll summarize the most important points and leave you with a simple action plan you can start using tomorrow morning. Part 10. Don't ignore the message your body is sending you. Let's bring everything together. Waking up with a dry mouth once in a while isn't usually a cause for concern. But if it happens almost every morning, lasts for weeks, or keeps getting worse, it's time to stop thinking of it as a normal part of aging. Your saliva does much more than keep your mouth comfortable. It protects your teeth, helps you digest food, controls harmful bacteria, and supports your body's natural defenses. When saliva production drops, your body loses one of its most important protective systems. For many older adults, persistent dry mouth is linked to medication side effects, diabetes, sleep apnea, dehydration, kidney disease, or autoimmune disorders. The symptom itself isn't the real problem. It's often the first clue that something else needs attention. So here's your simple action plan. Tomorrow morning, before taking your first sip of water, notice how your mouth feels. If the dryness is becoming a regular part of your mornings, don't ignore it. Review every medication you're taking, including over-the-counter products and supplements. Schedule both a medical checkup and a dental examination if the problem has persisted for more than a few weeks. Continue drinking enough water. Practice good oral hygiene. Use alcohol-free products designed for dry mouth. And don't hesitate to ask your healthcare provider whether your medications or another medical condition could be contributing. Most importantly, remember that early action matters. Many of the conditions associated with dry mouth are much easier to manage when they're discovered early. Waiting until new symptoms appear may mean you've already missed an opportunity to prevent unnecessary complications. Your body speaks quietly before it cries out for help. A dry mouth every morning may seem like a small inconvenience, but sometimes it's one of the earliest warning signs you'll ever receive. Thank you for spending these few minutes with me today. If this video helped you better understand what your body may be trying to tell you, please consider subscribing to the channel and giving this video a like. It helps us continue creating evidence-based health content for adults over 50. And before you go, I'd love to hear from you. Do you wake up with a dry mouth every morning? Or only occasionally? And did you discover something new in today's video? Leave your answer in the comments. I read as many as I can, and your experience may help someone else who is searching for answers. Until next time, I'm Dr. Nathan Ashford. Stay healthy, take care of yourself, and never ignore the small signals your body gives you today. They may protect your health for years to come.